Again, so for this discussion, I had questions 2 and question 7. Question 2 reads, in what situations did Teresa and other care team members miss opportunities to provide spiritual support to Mary or her family members? Could these team members have provided better spiritual care by working in concert with Teresa rather than leaving to her this responsibility to address the spiritual needs of Mary and her family? And in what ways might a better coordinated care team educated in the area of spiritual care have helped Mary's and her family's experience of death with more peace in the ER? So Mary is a patient of Teresa's. Mary has terminal cancer and Mary has a DNR. Over the course of the chapter, she gets sick and more ill, and the family decides that they want to let her go peacefully. So Teresa begins taking off her breathing mask and starts giving her morphine every 15 minutes to calmly help her pass away and be less agitated and less in pain. Before they did any of this, the family really wanted to find a priest so that they could perform the last rites before anything happened. So Teresa took in charge of that, and she had, since it was a holiday weekend, she had a lot of trouble trying to find a priest. Teresa was a new nurse, so she wasn't very familiar with protocol for finding one and or where to find one. And I feel that she could have reached out to some of her team members, or some of her team members could have reached out to her and gave them more information. It would have made this process a lot easier and a lot less time consuming. Ultimately, Teresa did find a priest, and he came and performed the last rites. But overall, the healthcare team missed several opportunities to provide spiritual support. During the whole process, Mary's husband Al was visibly very upset. No one attempted to comfort or speak to him. I think that anyone on the healthcare team could have approached him and helped him deal with what was happening. Mary could have asked for a hospital chaplain to come in and pray with the family. I think this may have comforted the family. And I think this is super important. So the Teresa as the nurse and the resident kind of wanted to push for this to happen, and the attending said they had to wait for the family to come to them, so they weren't really on the same team. So I think more communication between the resident, the attending, and the nurse would have allowed for better spiritual care and for Mary to be suffering for less time and the family to deal with what was going on. And overall, I think the main point of the chapter is that Mary talks about how she really wasn't trained to do any of this. It was her first time dealing with someone that was dying. She didn't feel comfortable hugging the family or talking to the family. So just education and what to do or what is okay in these situations would be very helpful. Next, for question 7, I had, in discussing the importance of clinicians attending their own spiritual lives, PNF quote Abraham Heschel, who said, to heal a person, one must first be a person. What do the authors go on to recommend for professional development and spiritual formation of clinicians so they may become capable of offering a healing presence? What barriers do they need to be transcended? In what ways did Dr. Samuels transcend these barriers? So the recommendations are that the clinicians be aware that illness affects transcendence. So you need to know that your patients are experiencing illness and this is affecting their spirituality. Also, as the quote says, it really says that you can't treat others spiritually if you aren't spiritual yourself. So the book recommends that they ask themselves transcendent questions to rediscover the meaning of healthcare and why they got involved in it. So it gives some ways to do this, such as reconnecting with the religion if they already had one. Take a few minutes of silence or prayer before each patient. They could do spiritual journals just to reconnect. If they wanted to, they could form spiritual discussion groups with other healthcare professionals, and just to make sure they were relating to their patients on a personal level. So you're seeing your patient as a patient, not just oh, that's another fracture, or that's another carpal tunnel that I'm treating, and being present in the moment with each of your patients and realizing that they're suffering. So the barriers that they identified to this are the economic reconstruction of healthcare. So right now, as you guys know, healthcare is really pushing productivity, and it really values efficiency above all else. It doesn't value compassion. So you need to realize that these economic incentives decrease patients' dignity, also shorten visits. When you have less time with a patient, you end up referring to specialists that you haven't necessarily met, or prescribing diagnoses that you haven't really prescribed before. So just realizing that the shortened visits affect time. And the book also talks about how there's been a scientific reduction by healthcare providers. A lot of people in the healthcare field believe in science. They don't necessarily believe in religion, and they deny the existence of transcendence. So if you're denying that it exists, you're probably not treating it in your patients, and this is a less personalized form of healthcare. So Dr. Samuels overcame these barriers. Dr. Samuel was a patient, an outpatient. He saw 30 patients per day. Susan was one of his patients that came in crying about a recent loss in her life. Initially, Dr. Samuels was very upset that Susan was putting him behind schedule. After seeing how upset Susan was, Dr. Samuels began to tear up and helped her reconnect with the force of goodness that she said helped her heal in her life. So he overcame these barriers by realizing that even though he only needed to see these patients for a shortened visit, he spent more time with them, and he wasn't focused necessarily on the efficiency, the economic of the healthcare, but on actually treating the patient. And he got in touch with his transcendence and realized that he needed to do more to help this person. And so this, for the first time in years, he found meaning in serving others and healing, and realized that healing was more than a quick fix. So he started using mind, body, and spirit, and it helped him establish rapport with clients, and it became easier, and he had more satisfied patients.